So this is your multidisciplinary care plan. Multidisciplinary because it includes both the nurses and the physician. So here is the front page of your care plan. So on this part, this is intended for the doctors. This is where they are going to write their care plan, or ideally, they have also to stick or to paste their own care plan, just like what our nurses are doing. For example, for Dr. Shaima, she can choose this one for ketoacidosis. For our other pediatric cases like neonatal sepsis, they can also put this one, our pedia doctors. Okay? So these care plans, you can find this one inside of our nurses station on the top where you are putting your nursing care plan stickers to. Okay? Now, all the nursing care plans, there is what you call tracking sheet. This tracking sheet, it includes your fall risk, skin, and aspiration. This is depends, or you will tick this box, depends on your patient's assessment. Okay? If it's geriatric, you can tick all this box. If the patient is post-op, you can tick this half, or it can also be fall risks. Or your patient is pediatric, prone to aspiration and fall risks. So this is depends on your patient's assessments or your patient's condition. Okay? Now, for example, let's go to the next page. For example, I am the nurse of this patient last night, and I have an admission at 10 o'clock. So I went to my patient, I do my assessments, and I identify the problem of my patient. So I choose my stickers. So this is now my stickers. I attach it to the care plan. So this is the time and date last night. So 10 o'clock. For example, last night is September 28th at 10 o'clock. This is the date and time when you identify the problem of your patient. So I will not write anything. I will not write anything here. I will just leave this one blank. Now, I will put my stamp here. I will ask the doctor to stamp also this one, meaning my doctor, the ROD or the consultant, agrees on this care plan that I attach to this paper. Okay? You tick these boxes. You sign, and you also let your ROD to sign. This is your responsibility to ask your ROD to verify or to stamp with your care plan. Okay? Now, 10 o'clock. Here comes. I'm about to endorse at 6 o'clock. So 6 o'clock, I want to do my assessment. I did my vital signs. I went to my patient, and then I assessed my patients. Now, what I'm going to do is I am going to evaluate my patient, and if this criteria or the goal either met or partially met. So it is 6 o'clock, 29. The following day, 29, and then 6 o'clock. And then I have to write it here, either partially met, and then my initial, CN. And who is the learner? It is the patient. Okay? For example, this is an adult case. Who is the learner? It is the patient. Okay? This is the legend. Patient. So I am going to endorse it. For example, the next one on duty is Lini. I am going to endorse it to Lini. So Lini will do the same. She will not write anything at the beginning of her shift. No. She will assess the patient at the end of her shift. So 6 o'clock also, or 7 o'clock if she is busy, then she can put it here. 1800 R or 1900 R, and then the criteria, either partially met or met. Then LK, her initial. I hope this is clear. Do not ever write the time, same date and time the patient admitted. This is not the right way on how you are going to evaluate your patient. Evaluation meaning at the end of your shift. Your plan This is your plan. You always evaluate at the end of your shift, which is 6 o'clock. If you are night shift, you will evaluate it 6 o'clock or 7 o'clock in the morning. If you are morning shift, 1800 hour or either 1900 hour. So this is how you are going to evaluate. Then, it was discussed also before by our clinical instructor that each patient, you should have 3 nursing care plan. Okay? At the back, here, I will put my stamp before I endorse and then my initial. Okay? Your initials on this part. Okay? So, next. For example, this anxiety. You have to remember always that this care plan is for your patient. Your patient teaching to your patient, but the care plan itself, it must be for the patient. Okay? So this anxiety, if adult, okay, I can put the anxiety because I identify the problem that my patient is anxious. So the patient itself is anxious. Now, if my patient is pediatric, 5-year-old, 2-year-old, or 1-year-old, and the parent is the one anxious, or the mother or the father is the one anxious, I will not. You shouldn't put this anxiety sticker. Because this paper is for your patient, not for the mother. The learner, yes, is the mother or the parent, but the problem that you put it here is for the patient. So there must be no anxiety sticker for your pediatric patient. Okay? Just like same with your whiteboard. The whiteboard is also for the patient or for the relative. Okay? It should be always patient-oriented. Okay? So this is only for adult patient, not for pediatric. Okay. Always remember, whatever you put in this paper, this is the problem you identified for your patient, not for the demographic, not for the parents or the mother. Okay? I hope this is clear. And always ask your doctor to stamp your sticker. I hope this is clear, and for those who are still confused, you can ask me and I will still discuss this one during our huddle or before our general endorsement in the morning. Okay, thank you.